Hi, welcome to Health and Information. This is February 2016. I'm Dr. James Bissland. And this month, our first program of 2016, we're going to focus on conditions for each of our programs this year. And today our condition is going to be the low back pain and the lumbar spine. Now, I have a spine here with me, and I want to kind of show you a little bit of the anatomy of the lumbar spine. Now we're looking here from the side, and the white areas here are the bone. That's called the body of the vertebra. The green are the discs between the vertebrae. Now this is a really important thing that we're going to talk about in the second half of the program today a little bit more. The little yellow areas right in here, these are the nerves, the lumbar nerves. Now the lumbar spine has 5 vertebrae. Now if we look at it from the back, you see these areas here. These are the bumps you feel as you go up and down the spine. They're called the spinous processes. Then the joints are right here. So you can see that as the vertebrae move, this opening where the nerves come out can get larger or smaller. With a misalignment of the lumbar spine, we're actually pinching these nerves, and wherever these nerves go, we're going to create a deficiency. Now previously we have talked about the subluxation, and I want to review the definition there a little bit of the subluxation. It is a misalignment of the vertebra, causing an interference to the nerve, creating a nerve malfunction. So we're pinching the nerve. The pressure that it takes to reduce the nerve supply is the weight of a nickel. And the weight of a nickel on these nerves can actually reduce the function of that nerve by 50%. So for instance, if we took the lighting in our office here and we cut the electricity to that light so that it was functioning at 50% of its normal value, we would see problems in the ballast, we'd see problems in the light bulbs. The life of the light bulb would not be as long. Now we also can see irritation of nerves. If the nerve is pinched and it creates an inflammation because of movement, then we will see hypernerve activity. And this is where we get a lot of our inflammation, and especially around the joints will become inflamed with the misalignment and create a little bit of hyperactivity of the nerves. Now, wherever these nerves go is where we're going to see the problems. And as we move along through the discussion today of the different conditions that are associated with a subluxation of the lumbar spine, we'll notice that the same problem, the same manifestation can cause a multitude of problems. I was talking to somebody, if you all remember back when we did our program on the addiction and compulsive disorders. The same brain defect can manifest itself in an addiction, a compulsive disorder, an ADD or ADHD. It's the same thing when we're talking about the spine. A pinched nerve is always a pinched nerve. It creates because of a misalignment of the spine, causing the pressure to be put on the nerve, creating the malfunction. That's a pinched nerve. That's also what we call as chiropractor a subluxation. Well, when that subluxation occurs, it can show up in multiple different ways, in multiple different situations, in multiple variety of symptoms. And this is why we have to do a complete evaluation. There are many times that we will have a patient come in and they have a problem, let's say, in the elbow or the wrist. But that problem is stemming from a pinched nerve of the neck. And I actually had this happen here recently where a gentleman came in and ultimately wasn't happy with us because he didn't want his neck treated he wanted his elbow and his wrist treated. The problem with that is that the condition that he had was coming because of a pinched nerve in the neck, and therefore treating the wrist and or the elbow alone without correcting the pinched nerve of the neck would not have solved his problem, and therefore obviously we would not have done that. The condition would not have improved. We wouldn't have seen any kind of a significant improvement there. You know, low back pain is one of the most common reasons people miss work in the United States. Low back pain can be caused by multiple things. It can be muscular, it can be neurological, or it can be distortion, joint related. So what I want to talk about first is just general backache, general low back pain. The nerve is pinched. The vertebrae are misaligned. It's kind of like the door going into your house. As long as that door is lined up with the door frame, it opens and shuts, and it works out pretty well. But let's suppose that your door now is not lined up with the door frame, and you go to shut the door, and it catches up here. And you have to push it hard in order to get that door to shut, or you pull it hard in order to get the door to open. You can let it go, and it will progressively get worse. Now, what a lot of people will do is they'll take in a plane and they'll go in there and shave off part of the door so that it now shuts and opens easier. That works for a while, but that doesn't solve the problem. So let's talk now about how we go about evaluating the low back and determine what the problem is. When we're looking at any person, especially the first time we see them, the first thing we want to look at is we want to look at the posture. We want to see how well it lines up with the pelvis, low back, shoulders, and head. We want to check for muscle imbalance to make sure that we don't have muscle spasms pulling on one side versus the other. We want to check for nerve interference to see where the irritations and or deficiencies of the nervous system are in play. We check bilateral weight to tell us how the body is responding to all of these distortions that may be present. Are we walking around with, let's say, 5 or 10 or 15 or hopefully not more than that weight on one side or one foot compared to the other? Because if you're walking around with 10 pounds heavy on, let's say, the right foot, every step you take is adding 10 pounds more pressure and more weight to that right foot, knee, hip, ankle. Then if we have a pinched nerve in there that can be caught up in some of the muscles, we can create pain going down into the leg, and we're going to get into a lot more of that in the second half of the program. We also will do a we'll call our A to P posture evaluation. What that tells us is as you stand up, is your body leaning forward or is it leaning backward? That, again, combined with all the other exams and posture analysis that we've done, will show us how your body is responding to the distortions. We use Posture Pro, which is a computer-aided posture analysis system that does more than just show us the posture, but it shows us how much extra force is being put into the spine because of distortions. And finally, of course, we have X-ray. An X-ray will show me the bones, show me the misalignment, the distortions, the pelvic abnormalities. And we take all of these things and we put them together, which gives us a true picture, a thorough picture of what's going on with your spine. At that point, I can look at the X-rays, I can look at the Posture Pro, I can look at the A to P analysis. I can look at the bilateral weight and piece everything together into a package that shows me where the problem is. I need to know what level that problem is. What area of the spine am I dealing with? I need to know how severe that misalignment, that subluxation is. I need to know how long it's been there, and I need to know what it's doing to you. And at that point, I can make a determination as to whether or not that's something that I as a chiropractor can do, or whether we need to refer you to another type of provider. When we come back from break, we're going to go through a variety of conditions that can be related to a subluxation or a pinched nerve of the lumbar spine.
An accident can turn your life upside down. Immediately, you may face problems like who will treat your injuries? How will your car get fixed? What are you going to drive in the meantime? You need solutions now. At Benedict Law Office, the care you deserve can begin at your own home. No office visit is necessary, and you pay no fee if there's no recovery.
At Benedict Law Office, there are no problems, only solutions.
Call Benedict Law Office for your free consultation today.
Are you in pain? Then meet the doctor. Neck pain, headaches? Meet the doctor. Low back and leg pain? Meet the doctor. Arm, shoulder, and hand pain? Carpal tunnel syndrome? Meet the doctor. Injured in an auto accident? Meet Dr. James Bissland at Bissland Chiropractic, where you can get your first visit free this month. Call Bissland Chiropractic at 838-4252. Bissland Chiropractic.
Where were you when the lights went out? Who did you call and when you gave them a shout? Did they pick up the phone? Did you get a machine? Or some front office drone? You know what I mean. You want to talk to somebody who knows what they're talking about. So call Marie now. Electricians with a mission will get you connected. We're Murray Electric.
Hi, this is Larry Murray with Murray Electric. We appreciate your business and we don't take you for granted. While nobody likes to have electrical problems, we want you to know that we will be here for you when you do need an electrician. And remember, you don't get phone shuffle when you call Murray Electric, because we have a real live electrician that answers the telephone. Remember, if you're in a hurry, call Murray, 918-835-9605. 918-835-9605.
We'll get you connected. We're Murray Electric.
Welcome back to Health and Information. This is February for 2016. And we're talking this month about low back pain, subluxations, pinched nerves of the lumbar spine. As I stated earlier, that low back pain is one of the major reasons why people miss time from work. And that also happens to be one of the easiest things for us to treat. And you know, so many people, and I hear this when I'm out at screenings and I'm out at like the Tulsa State Fair, so forth, it says, well, I've heard stories that once you start chiropractic care, you have to go forever. And for most people, that just isn't true. There are some people who have a weakness or a deformity or a degeneration is so far along that they do require, after the initial phase, maybe some spinal rehabilitation. They may need some neuromuscular reeducation to help with their balance and equilibrium. But also then they may need maintenance care, just like we take care of our car. We do our oil changes and our tire rotations and our misalignment or front end alignment. This allows us to maintain where we are now so that we don't have people who are getting worse as we age. For the rest of the program, I'm going to talk about specific conditions that we see related to the subluxations of the low back, and of course low back pain would be the number one that we see. But low back pain can be bone, it can be joint. For instance, on our spine here, if we had a twist in here and the joints were irritated, that can create discomfort and one type of pain. Muscle spasms are a very common finding with lumbar subluxations. We actually can feel those muscles just knot up and tighten up, and they build up with lactic acid, and they create trigger points if they left go, and the trigger point just stays there and it just locks up and it just hurts. So one of the nice things that we do, and we have multiple therapy modalities that will help us to relax the muscles after the adjustment. After we release the pressure on the nerve, we want to go in there with either some electric stim, some infrared therapy, some vibratory therapy called Qigong, or hydromassage table to actually go in and reduce those muscle spasms and relax the tissue and so forth, to help reduce the discomfort, help reduce the pain, but also to help the subluxation to be reduced and for my adjustment to hold longer. Another thing that we see with people who have a pinched nerve in the low back is sciatic pain. Now, sciatic pain is pain that runs down the back of the leg, and it can go from just the middle part of the back of the thigh, it can go down to the knee, it can go all the way down to your foot and even into your toes. Now, sciatic nerve is the largest nerve of the body, and it is formed by 4 spinal nerves coming out of the low back and upper part of the pelvis. A pinched nerve in any of those 4 areas can initiate the symptoms of the sciatica. There's also a muscle in the pelvis that if there's a pinched nerve to it, it's called the piriformis muscle, and it's right under what we generally call the hip joint, but it's technically called the sacroiliac joint in the pelvis. That muscle is just a very small, kind of a pear-shaped muscle, but the sciatic nerve runs right through it. So if that muscle goes into spasm, it'll pinch down or clamp down on the sciatic nerve, and that creates a totally different type of sciatica, even though it may feel very similar. As I was saying with the elbow and wrist earlier, it is a totally different type of problem that needs to be treated in a completely different manner. The type of pain that you have, the manifestation of pain that you have, is totally dependent upon the part of the nerve or the nerve level that is interfered with. So a lot of times we'll have some people who will have pain shooting out to the side of their hip and down the side of the leg. That comes from a different area of the spine than, let's say, a sciatica would. We also see pain in the pelvis. That would be like the piriformis, but sometimes people will just have pain in the muscles of the back of the pelvis. The gluteal muscles will just be tight. They spasm, they're in pain. You try to stand up, they hurt. You try to sit down, they hurt. You twist, they hurt. You walk, they hurt. It's because the gluteal muscles are among the strongest muscles of your body, and you use them for just about everything you do throughout the day. Knee pain can be related to multiple things. A pinched nerve in the low back can cause pain to radiate down into the knee, or it can cause a muscle to spasm, which pulls the knee joint out of alignment, or it can cause a pelvic misalignment that then pulls the bone from the pelvis to the knee, called the femur, pulls that bone out of alignment, which then makes the knee joint dysfunctional. A lot of times we'll see in a knee pain situation where we have a torque of the knee joint itself. Again, can be caused by foot imbalance, can be caused by muscle imbalance, can be caused by biomechanical distortions. And we need to realign that knee, but we also need to look at the hip, we need to look at the low back, we need to look at the ankle to make sure that one of those isn't the primary cause of the pain in the knee as well. Now, for knee injuries, that's a different story. However, a lot of times when somebody has a knee injury, they've also injured another part of the spine and pelvis that we also may be dealing with as well. Same thing goes for ankle pain. A lot of people don't understand when we look at their ankle, they have pain there, but a lot of times we'll test for the low back. We look for those pinched nerves because we know that a certain group of nerves goes right to the ankle. And again, remember, wherever we have nerve interference, wherever that nerve goes is going to have some deficiency and potential for discomfort, pain, malfunction, and so forth. Now, when we find a low back subluxation that's untreated, these discs that we were talking about here earlier, because of a twisting of the spine, or a forward motion, or a side motion, or hyperextension of the low back, can cause these discs to push forward, backward, left, or right. Now, the disc is a very hard callus type cartilage material with a liquid center. It kind of reminds me of that gum that they used to have out back years ago. There was a hard outside, then you bit into it and it had a liquid center. Well, as we wedge the spine, that liquid center starts pushing toward the open side of the wedge, and it can start to wear these layers of the disc, wear them thin, and start to break through them. As it does that, it'll push the disc out and become a protruded disc or a herniated disc. If left go long enough, it'll actually break through the outer layer, then it becomes a ruptured disc. Once it gets that far, we're out of something that I can do. That's a medical problem there. Other problems that we can see with low back pain is herniated discs, or other than herniated discs, is menstrual cycle dysfunction, disorders of digestion, stomach problems, bowel irregularities, colitis, things in that regard, bladder dysfunction where you can't hold the urine or they can't empty the bladder completely, and then also abdominal pain. Now, abdominal pain can come from the bladder, it can come from the bowel, it can come from muscles. In women, it can come from the uterus and the ovaries and so forth. All of these things can be related to low back, and that's why somebody comes in and they have a low back pain or they have this pain. We want to be thorough. We want to completely evaluate that spine to make sure that everything is done properly, that every step is taken to alleviate the problem, the cause of the problem, so that we can alleviate the symptom and correct it and hopefully prevent it from returning. I hope this has been informative for you and beneficial. I hope that you've learned a little something. If you have any questions, our contact information is here on the screen. You're welcome to contact me. We offer a complimentary phone consultation, so you can call and talk to me at any time. There's no obligation, and of course there's no cost for that service. And until next month, I hope you have a healthy, happy, and safe month. I'm Dr. James Bissland.